Studies published in the Journal of the American Headache Society state that up to 50% of people have head, neck, or facial pain. Headaches, including tension, stress, and even true migraine, cannot be diagnosed by X-rays, CAT scans, blood tests, and even MRIs. Therefore, most treatment is directed at symptoms as opposed to the cause. Clinical evidence conservatively estimates that at least 40 million people's head, neck, and facial pain or dental damage may be caused by occlusal interference. But identifying pain due to occlusal interference can be both difficult and time-consuming for even a highly trained doctor, so this condition often goes undiagnosed or misdiagnosed. The Best Bite Discluder is unique in that it is based on a 50-year-old proven methodology to help and treat pain caused by occlusal interference.
I started getting headaches about 6 years ago. At first, maybe once or twice a month, but over the years, they've gotten much worse. The pain can be on the side of my head, or sometimes around the ear, or sometimes it can start at the top of my head and then just radiate down my neck. Lately, I've been getting as many as 2 or 3 a week that are so painful I have to stop what I'm doing and even leave work. At first, I went to my doctor, and he ordered X-rays and blood tests, which didn't show anything. So he sent me to a neurologist, and he ordered an MRI, which also didn't show anything. When nobody could find anything, they told me that I had some sort of migraine or tension headache. I've tried everything to help control the pain. I've gone to a chiropractor for over a year. I even tried acupuncture. I've taken everything from ibuprofen to prescription drugs, and I need to do something else because I know taking all these painkillers is not the answer.
The jaw is attached to the skull by the most complicated joints in the body. They are the only joints that move in 3 dimensions. The only pair of joints where both the left and right have to work together, and the only joints whose ultimate position is determined not by bones and muscles, but by the teeth. The jaw is a mechanical lever. In order to operate properly, it must have a stable fulcrum. If the teeth pull the jaw out of the socket, it destabilizes the jaw joint, stressing the jaw muscles and possibly causing pain that cannot be diagnosed by conventional medical tests. Muscle contraction pain can radiate and refer to other areas of the head, neck, and face with varying intensity and frequency. A landmark study by Dr. Janet Travell demonstrated that the patient's perception of head, neck, and facial pain was usually distant from the location of the pain stimulus. That is why pain from occlusal interference is often referred to as medicine's great imposter. Many people unconsciously clench or grind their teeth in response to the conflict between the teeth and jaw joints, not because of stress. Because tooth clenching and grinding cannot even the bite, it continues indefinitely. Dental consequences of tooth clenching and grinding include damage to the jaw joint, and biomechanical dental disease, including ab fractures, gum recession, broken, chipped, and worn teeth. Treating the pain of occlusal interference is simple. Center the jaw and allow the muscles to release. This is not a forced position. It is where the jaw joint would naturally go if the teeth would let it. This is not easy because every time the patient closes their mouth to bite or swallow, the teeth pull the jaw joint out of the socket, causing muscles to cramp even more. The Best Bite Discluder addresses the pain for what it is, a biomechanical problem. The patented design of the Best Bite Discluder incorporates a universal discluding element that adapts easily to the patient's upper front teeth using our custom liner material. The contact area of the lower incisor teeth on the Best Bite Discluder is on average 3.5 inches from the center of the jaw joints. The angle of the glenoid fossa is typically no less than 25 degrees. The patented 8-degree angle on the Best Bite Discluder will gently facilitate the condyle's upward and backward movement to a centered position. Let's take a look at a typical patient visit.
So, do you have any pain right now?
Yeah, it hurts here and back here.
And if you had to rate the pain from 1 to 10, with 10 being severe and 1 being perfectly comfortable, where are you right now?
Right now, I'd say it's about a 7, but it can be as bad as a 9 or a 10.
So what I'm going to do is I'm going to put my best bite discluder in your mouth and let that help tell us if your bite is part of the problem.
Okay.
Open your mouth a little bit, please. So all you have to do is just tap your teeth up and down as we slide this in. Go ahead and just let your jaw relax a little bit now. Okay, I want you to keep going while I let go, okay?
Mm-hmm.
Okay. Does that feel any different now?
Yeah, it feels looser.
Okay, let's keep tapping now. Do you have any discomfort right now?
Not really. It's kind of gone away.
From 1 to 10, where are you now?
2, 1.
Okay. Let's take this out. And just close your teeth together and squeeze up a bit. Swallow a couple of times. And tell me how you feel now.
Yeah, it's starting to come back. I can feel the pressure starting to build up.
And from 1 to 10, as far as pain?
About a 4 or a 5.
Okay, let's put this back in now. Let's tap up and down again. How are you feeling now?
It's gone again.
It's great. Let's take this out. So what do you think?
I can't believe it. I've had these headaches for 6 years, and in 15 seconds, they're gone. I just can't believe how fast they went away. Do I have to wear this thing all the time or sleep with it?
No. What this has proven is that your bite is the source of the pain. So all we have to do is eliminate the conflict between your teeth and your jaw joints, and that will take away the pain. And you can use a discluder between visits to manage any discomfort you might have in between.
Great.
The Best Bite Discluder always works. If it takes the pain away, then the doctor and patient can feel confident that the bite is part of the problem. If it does not take the pain away, the bite is probably not the source of the pain. By helping to determine who should or should not be treated, Best Bite helps to ensure a successful result.
My headaches, my facial pain, my TMJ is something that I've lived with since high school. But I didn't know that it was TMJ. My mother had taken me to the family physician who had referred me to the allergist, and I then also went to the eye doctor because it was probably eye strain with my facial pain. And I believed this.
2.5 years ago, I began to notice an incredible discomfort in my jaw and actually some numbness. And I didn't think very much about it. I went to see my dentist, who looked at me and said, I think you should relax. It's probably something psychological. And it kept getting worse and worse. And I kept going back to him and saying, look, it's got to be something more. And he looked at me and he said, well, let me just do a little bit of filing. And he did a little bit of filing and suggested that I see a therapist and begin to do some type of relaxation. It kept getting worse. And so I went to my doctor, who recommended that I go to a neurologist, who recommended that I go to an ENT person, who recommended that I go to yet another dentist. who then put a bite plate, a night retainer, and suggested that I get my whole mouth redone.
It started, I would say, during high school. I would get them in the morning upon awakening, and then I would get them about 3 o'clock in the afternoon and in the evening every day. I would take Excedrin or some ibuprofen 2 to 3 times a day.
My TMJ was diagnosed with the discluder. It was shocking to me because I couldn't believe that it could be this easy for me, that I didn't have to work, that I didn't have to do anything that was painful, yet it was taking my pain away.
And immediately, after being fitted for the discluder, once it was placed in my mouth, I began to feel a sense of comfort that I had really not experienced for over 2 years.
He put it in my mouth, and within seconds, I felt relief through my joints and under my eyes. It went from like pain being a 10 to like a 4.
And Dr. Simon has adjusted my bite. I don't have the facial pain. I don't have the headaches. It's a wonderful thing to be free of that.
And feel about as free as symptoms as I felt 3 years ago.
Because you live with this 10 years, and then all of a sudden, it's gone in 30 seconds with this little device about this large.
The Best Bite Discluder is part of a proven system to help treat pain caused by occlusal interference, unlike other methodologies like drugs or dental tension suppression systems that only mask symptoms. The Best Bite Discluder helps any head, neck, and facial pain doctor to determine if the patient's bite is the cause of their pain. By providing immediate pain relief, the Best Bite Discluder allows the doctor and the patient to confidently proceed with safe and effective bite treatment. The Best Bite Discluder can also be used between visits to manage discomfort. The Best Bite Discluder is totally reversible. When being used correctly, there is no risk of damaging the teeth or the jaw joint. The Best Bite Discluder, easy to use, rapid results, safe and effective.